South Africa's cases of COVID-19 crossed the 300,000 mark on Wednesday as its healthcare system struggles under the weight of rapidly rising infections. According to the World Health Organization, there were 108,098 new cases across Africa for the week to July 14, and of those, 76% or more than 82,000 were reported in South Africa. That's pushed the continent's most industrialized economy into the top 10 worst affected countries globally, with more than 311,000 infections.
I feel bad because our country is going down now.
Health officials say in some parts of the country, COVID-19 wards are packed and patients spill into other departments or tents outside. At public hospitals, which were already strained, medics have complained about a lack of staff and protective equipment.
I'm very worried.
That's increasing fears for people like Johannesburg resident Gift Matlala.
It's something that can kill, that has a potential to kill maybe half of the population in the world.
But with just around 4,300 deaths, barely 1.5% of cases have proved fatal so far, in part because of a young population. Those figures will rise, though, if shortages of hospital beds and oxygen worsen, and scientists have predicted up to 50,000 deaths. The increases are happening despite the early implementation of one of the strictest lockdowns in the world. And one senior economist said what has become clear is that lockdowns don't work in countries with a large informal economy because people can't afford to stay home. The WHO said over the past week, 5 countries have reported the highest increases in cases of the new coronavirus: Lesotho, Namibia, Madagascar, Burundi, and Angola, and that South Africa's neighbors Lesotho and Namibia have been among the top 5 countries in the past 3 weeks. The WHO warned countries must continue with strong implementation of comprehensive public health measures in order to slow down the rapid growth in cases.